Not a single vaccine has gone through a placebo-controlled study with saline. They say that's unethical, that it, in my opinion, is unethical to start injecting pregnant women and children without any safety profile. The pre-licensing, they compare, vaccines to vaccines, and they have similar adverse events.
Welcome back, everyone. Thank you for staying with us on the Dr. Nandi Show. Really interesting debate so far regarding vaccines, the same debate that's out in the public right now. And we're now joined by all our guests, Dr. 𝗖𝗵𝗲𝗧, Joel Dorfman, Dr. New and his wife, Patricia. Thanks for staying on. I appreciate it. I'll start with Dr. 𝗖𝗵𝗲𝗧. So in a previous segment, Joel mentioned that pediatricians are not qualified because they only get 2 hours of training on vaccines. And I thought that was not the case. Please, can you tell us a little bit about how qualified are pediatricians?
That's actually a very interesting statement, because I think what people think is when you all graduate medical school, you have the same education. This is a true statement. And yes, immunology is just one portion of what we learn in medical school. The thing that happens is once we leave medical school, we all have our own extra education. So all of these extra years, for example, that I spent at Children's Hospital of Michigan were not in vain. We learned every subspecialty of pediatrics. We had hours and months actually where you're dealing specifically on infectious disease patients, where you're rounding with infectious disease doctors, where you have extra training that's unique to the pediatric specialty. So it's one of those, I feel that it's quite an education.
So way more than 2 hours.
Oh, yes.
Yeah, and so that's what I think a lot of people don't know, and I think it's good to educate folks that are out there. Patricia, a question for you. Safety about vaccines, because a lot of people are worried, and we talked about it in the beginning. None of us, you saw between the break, I have a small child, and none of us want to harm our kids. What do you think about the safety of vaccines?
Absolutely. And there's a lot of slogans out there saying, vaccines are safe and effective and protect your children. And the truth of the matter is, if you look at the science on vaccinations, it's very poor. They compare one vaccine to another vaccine, 5 vaccines to 10 vaccines. Not a single vaccine has gone through a placebo-controlled study with saline. They say that's unethical, that it, in my opinion, is unethical to start injecting pregnant women and children without any safety profile. The pre-licensing, they compare, vaccines to vaccines, and they have similar adverse events. And so it's kind of like what the tobacco companies did with tobacco science. They compared people who smoked 40 cigarettes to 43 cigarettes, and there was no difference in cancer or COPD. None of the studies have been appropriately safety tested, number one. Number two, the next best thing you can do is a vaccinated versus unvaccinated study. Look at a group of children that get the intervention, compare it to a group that don't. The CDC refuses to do that. There's one small study.
Do you know why, by the way?
They refuse? Why they refuse? No, I don't know why they refuse.
Because they don't want kids to die. It's so we can never.
But kids are dying from vaccines.
3 to 5%. But if you were telling me that if you give unvaccinated kids and say I'm going to do a clinical trial, it will not pass any board of ethics. So before you do a study, but let me just tell you about studies though. There are no retrospective studies to look at. You have to do a prospective controlled study. So what you're suggesting.
You can start with a retrospective study like Mawson did.
You cannot start the retrospective
because what you do is and unvaccinated.
And what happens is what's happening today is that when you have unvaccinated kids that actually get exposed to measles virus, they get measles far more than unvaccinated kids. So what you have to do to answer your question is a prospective randomized controlled trial. That's what you're suggesting. The problem why we don't do that is because we can't have kids die. We cannot have kids die to prove the point, because then let's say somebody says that and you're satisfied, well, 10 kids have died, and we stop studies in the middle when that happens, in the middle of their studies. So no ethics board will approve that.
But we have 10 children dying a day in this country of SIDS.
But you have 3 million that actually get saved from it. SIDS will not be caused by vaccines. SIDS caused by an infection.
Did you look at Dr. Morrow's study from the CDC in 2015?
Because I went to medical school where even I know that. I'm not a pediatrician. I went to medical school and we took care of kids with SIDS.
Have you looked at the research? Have you looked at Dr. Morrow's study?
I have looked at the research, but have you looked at the other thousands of studies that have showed that SIDS is not caused by vaccinations. All I will say is that the point that you brought about studies, no ethics board in the world would approve that study, and that's why we don't do it.
For pregnant women?
The reason we can't do a study where we'll say, okay, are car seats really safe? Well, then let's do 100 kids in a car crash with a car seat, and then 100 kids in a car crash without a car seat. It's unethical.
But you're not injecting toxins
safe.
into your body in a car seat.
They are not toxic.
Do you know the aluminum? Do you know how much aluminum is in a vaccine?
Yes.
How much?
I would like to tell you, the amount of aluminum in every vaccine combined that we give from birth to age 18 is equal to 30 ounces of formula. Babies drink that in one day.
Okay, you're a doctor. Now, parents, you can tell parents that.
Yes.
But there is a huge pharmacological difference in absorption, in oral, and injecting. Do you know there's a federal?
We absorb aluminum every single day because
How
we
much?
live on the
How
earth
much?
and the earth's
How
crust.
much?
We
How much?
absorb it with the water we drink,
How
with what we
much
eat.
do you absorb? You know
But
what's absorbed when you inject?
both of you know that multiple studies have been done about every additive that's in vaccines.
That is not true.
They have been
Yes,
done.
it
Never
is
been a
not
study
true.
on injected
There
aluminum.
have
Ever,
been
ever,
studies on
ever,
every
ever.
additive, and it's
No.
shown
We
to be
have.
below
That's
safety
misinformation.
levels.
That's
I can also tell you that a French fry can kill you. It can, if you go to the right person, they will drop
So
dead.
that's what we need to
So what I'm
ask.
saying is this, to say that we should study it, absolutely. If it was ethical to study it, if you could get an ethics board to prove it, what I'm saying, there are going to be people that have a reaction.
We have the data right now.
We
Vaccine
don't,
Safety
we
Data
have the
Link has
data.
thousands of kids who are unvaccinated. Look at the most recent study on the MMR vaccine and autism out of Denmark. Okay, they studied 650,000 kids. 31,000 didn't get the MMR. Of those 31, 21,000 got the entire vaccine schedule except the MMR. About 5,600 got at least one set of vaccines, and 4,700 got no vaccines. Now, common sense would say, let's compare those 4,700 kids to the people that got all the vaccines. Did they do that? Of course not. They put it in this big group.
Because,
so whatever it,
because it's an association. Here's the problem with that. See, when you see two things together, you can show. So let's say you compare blue genes with getting asthma. So if you see blue genes with asthma, it doesn't mean the blue genes cause the asthma. Let me take a quick break. We'll come back right to it. This is a great debate. This is what we talk about, in the public, but at least hopefully we can give you some semblance of an idea what's going on. Please stay with us. Hi everyone, I'm Dr. Partha Nandi, and if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.